Hey, I'm working on a new presentation for the office, and I want to share something with you out of that presentation, but it's actually called Healthy to 100. It's going to be coming up in a couple of weeks, and essentially what we're going to do is we're going to show you how to actually make it, or at least improve your odds to get to 100 years old healthy. And some people say, well, I don't want to live to 100 years old. Well, God forbid you do, right? You don't get to pick. Last I checked, we don't get to determine how long we want to live. So if you make it to 100, whether you like it or not, what is those last 15, 20, even 30 years going to look like for you? Where are you going to spend them? What sort of things are you going to be doing? What quality of life will you have? And how to actually try to start to set those things in place to give yourself a better chance. One of the things I'm going to talk to you today is about banking. Okay, we're going to talk about banking with your health, because everybody, whether you're younger than me and you haven't even thought about retirement, or you are retired at this point. I know we've got people from all walks of life probably watching this video, but most of us have thought at least for a moment about retirement. And we know that around, 55, 65, 70 years of age, most people will try to retire. And at that point, what do you live off of? You live off of all of the deposits that you made, all of the stuff that you put in earlier in life. You don't go and hit 65 and say, well, I've never saved a penny and now I'm going to retire. Any financial planner on earth will tell you you don't have that option because you haven't built any income. You haven't built anything to live off of. Health is the exact same way. And we're all thinking about money, right? Everyone's focused on money, Roth IRAs, 401ks, retirement accounts, and all this stuff, and we're planning for the future. But how many people do you know make it to 65, it's time for them to retire, and pretty much every penny that they've socked away, they spend on major medical expenses because they're dealing with things like diabetes and cancer and heart disease and those sort of issues. We see that every day. They spend all of their health accumulating wealth, and then they spend all of their wealth trying to regain any shred of health. And what it comes down to is simple mathematics. It's deposits versus withdrawals, right? Anytime that you make a deposit in terms of your health, that's going to pay off long term. That's going to give you long-term results. Anytime that you take a withdrawal from your health, again, that's going to withdraw long-term from your health. So let's think about things like deposits would be eating food by God, eating real food and trying to nourish your body, okay? You're actually eating to live rather than living to eat. Taking the correct supplements, making sure your body has all the nutrients it needs to build you healthy. Getting regular adjustments, making sure that your nervous system is totally clear, your body has the ability to communicate and do what God designed it to in the first place. Exercise. Now, whether that be, where you're doing P90X and really putting a lot out there, you've hired a trainer, or you're just making sure that you and your family go on a walk in the evenings. Okay, or that you do something really simple in your bedroom floor, that you're taking cans of cream of chicken soup and doing some sort of exercise. Those are all deposits that if you do them on a regular basis are going to do nothing but sock away in your bank to be able to use those long term. Now let's talk about withdrawals. When you decide to skip the gym, that's a withdrawal, right? When you decide that you're going to have, a diet of hamburgers, or you're going to continue to eat processed foods, those are all things that are going to take a withdrawal, right? When you keep eating drugs, you're taking one pill after another, you're on 12 or 15 prescriptions, and you think that that's actually making you healthy, those things are all withdrawals, all right? They're allowing your body to continue to be sick, but allowing you to be symptom-free while that happens. Anytime that you're stressed to the max, okay, that you're not actually getting quiet, spending time with God, that you're not spending time with your family, that you're focused outward, you're focused on how much more you can squeeze out of your job, your finances, your life, those are all withdrawals. Those are things that you're going to have to deal with long term. And what happens is people get to the end, they get to retirement, let's say 65, 55, we're seeing people hit that crisis phase early and early. So you got to imagine the fewer deposits you put in and the more withdrawals you're going to take, you're going to hit that end point much faster than somebody else. And then all of a sudden, it's, oh my goodness, what happened? What's the matter? Where's my health gone? Why do I have all these diseases? Why am I taking all these medications? Why do I have all these illnesses, doctor to doctor to doctor? And it's all simple mathematics, withdrawals versus deposits. So what I want to do today is challenge you to start to think that way, right? Every time that you do something bad, and hey, I have a hamburger, you know, I'll do things, I'll skip the gym from time to time, those sort of things, but I understand that's a withdrawal. I'm going to take personal responsibility. I understand I just made a withdrawal from my health. Anytime that you do something good, okay, that you get an adjustment every week, that you're eating good foods, you're taking your supplements, you're exercising, you're reading your Bible, spending time with your family, feel good about that, right? You should actually have a really emotional good feeling about that because you're putting deposits into your health account. And long term, I mean, without your health, it doesn't matter what amazing humanitarian things you're going to do. It doesn't matter what philanthropic things that you have planned, what mission trips you want to take, what time you want to spend with your family, what extravagant vacations you've planned. If you don't have health, you don't get to do any of that. You're totally tied down and you can't live the life you were designed to live. I hope this makes some sense. If you find this even mildly intriguing, I want to challenge you to make it to our Healthy to 100 presentation. I'm going to talk for about 45 or 50 minutes, not only on how to think about things, but actually real life strategies to start to put in place for you and your family. Because let's face it, if you make it to 85, what do you want the last 10 years to be like? Do you want it to be in a hospital bed? Do you want it to be home hospice? Do you want it to be in a nursing facility? Or do you want it to be on a cruise ship, right? Do you want it to be actually fulfilling your dream, to be able to be a positive effect on other people's lives and doing the things that you love to do with the people you love to do it? Thanks for letting me share. God bless.